You also have a lot of people who are taking berberine for various reasons. Let's cover that. What's with the berberine plus, and then going into kind of the gut lining.
Yeah, so Berberine Plus is a great product to take for lots of different reasons. I think berberine as an individual ingredient, people use it for different reasons. Sometimes you'll see it in protocols for gut dysbiosis, such as like Candida, because it's a great antifungal agent. Specifically with Berberine Plus, you're looking at a product that has both berberine and lipoic acid in combination with one another. Usually when you see that type of combination, you're thinking more cardiometabolic purposes. And so when you think of metabolic syndrome, which is that classification of having metabolic dysfunction, right? You're looking at things like elevated waist circumference, an elevated fasting blood glucose. You look at things like elevated triglyceride. There's really 5 markers that you're looking at. And so Berberine Plus is a great product to use for people that are approaching that full onset of having metabolic syndrome. So what I love about it is that is a great product that when you think of what traditional medicine is, and again, traditional medicine serves its purpose. I'm not saying anything against that, but it's more of the wait and watch paradigm. When you have products like Berberine Plus, it's like, hey, I see that maybe I have high insulin, and I know that I'm probably eventually going to have, a full blown out diabetes or dysregulation with glucose. Like, are there things that you can take to prevent that from happening? And that's really the sweet spot of where Berberine Plus fits in. It's going to help with insulin sensitivity, and it's also going to help with glucose transport within the cell. And so it's fantastic to use as like a first line therapy for patients that find themselves in those types of situations.
Yeah, it's almost always a go-to. If I know somebody who's struggling, if I see that their HbA1c is elevated, their insulin sensitivity, their glucose is elevated, and they've been struggling, it's almost always because it works so well to just help that person get over that hump. And also, I just found it to work way better than some of the things that we've used in the past. So,
Yeah,
yeah.
fantastic.